Hi everyone, I am Dr. Aruna Devi. I am Director and Chief Consultant Dermatologist of Essence Skin Clinic, Guwahati, and today I am going to speak on hair loss and its management. So we all know hair plays an important role in everybody's life, and regarding today's socio-economic condition and the perception, it plays a huge impact on psychosocial impact on everybody's life regardless of his or her age. Too often we notice that the delay in the diagnosis of hair loss, the cause of hair loss often leads to permanent discomfort or disability regarding the treatment of hair loss and recovery. So it is very important for us to diagnose correctly what is the cause of hair loss and how to treat it, and whether we can reverse the hair loss or whether it's going to be permanent to some extent. So hair loss is an important cause of discomfort and disability in everybody's life. So amongst all the types of hair loss, androgenetic alopecia, it is the commonest of all causes of hair loss. So it involves the male and female as well, what we call progressive or patterned hair loss. So it can be progressively involved, the progressively loss of visible terminal hair or visible terminal hair specifically over the frontal scalp as well as the temporal scalp. So it's a miniaturization of the hair initially, gradually, and extending up to the baldness. So it is called the pattern baldness, regardless of male or female. But male, it is very obvious because it is a pattern baldness. Whether it medically we call it, it's divided into Norwood classification, that is a different thing. But the thing is that in male it is very obviously visible, and but female it is a global hair loss. So it is in initial stage it is not visible, but afterwards it becomes very visible, and when it becomes very visible, it's become almost permanent. It's very difficult to treat accordingly. But in male pattern baldness, when the hair loss increases up to some certain stage, it becomes very obvious, and it becomes a source of discomfort for the patient, and he usually seeks advice for this. There is strong genetic disposition regarding the etiology or cause of androgenetic alopecia. There is a higher incidence of circulating androgen, and the strong receptor susceptibility in the skin as well as in the androgen sensitivity in the circulating androgen level in the body and as well as in the skin. So the functional intercellular sensitivity of the skin cells towards the androgen, it is the main factor which is the key factor for progress of the androgenic alopecia. So what happens, it's the metabolism and as well as the level of circulating androgen on this, and the level of dihydrotestosterone which causes an important role in precipitating androgenetic alopecia. Regarding management of androgenetic alopecia, we will have to be very careful, and there is a strong genetic susception, so we will have to keep that in mind, and as well as the hormonal section. Then there is a certain modalities of treatment, both conservative as well as surgical nowadays are available, and those are very much hopeful for the patients, and it includes both conservative and surgical management, and which are of very helpful for the patient. And amongst conservative treatments, some topical solution as well as some oral tablets are also available. In the non-hormonal therapy, those includes like minoxidil, which is widely available and widely used by us dermatologists, and it is 2% to 10% sometimes we can use as a topical solution. It increases the vasodilatation, it increases the growth factor, and it eventually increases the hair growth. And as well as sometimes what we give with topical minoxidil, some finasteride topical solution, some azelaic acid, tretinoin, and some other growth factors like apigenin or capixil or procapil. Those are added along with minoxidil to enhance its capacity to increase the hair cells. Some other 5-alpha reductase type 2 inhibitors, like those are included in hormone therapy, like finasteride or dutasteride, are available nowadays orally, which can be taken very safe, very effective for a longer time for management of hair loss, androgenetic alopecia, specifically in male. This hormonal therapy along with the non-hormonal therapy actually gives a very good result, and for maintenance it's very effective. And nowadays what can be done, some anti-androgens, those are also used, like cyproterone acetate or clomiphene citrate along with estrogen. Those give very good effect along with minoxidil topical solution, specifically in case of female pattern baldness. Some other oral supplements are also available, like folic acid, cysteine, methionine, biotin, all are and omega fatty acid. Those are also helpful to some extent if they are judiciously used along with minoxidil or along with the non-hormonal or hormonal therapies. Some other procedures like platelet rich growth factor and some growth factor serum are also available nowadays. Those can be injected or they can be implanted with dermaroller or dermapen, which gives a very good result if those are done very precisely along with those medications. Then comes the hair transplant, that is the surgical procedure. Lastly come to hair transplant. So it is the ultimate surgical procedure which can give a very good result, and it usually changes the impact of hair loss in a patient. And there are so many techniques are available, FUE, FUT, or microcell follicular hair extraction, or some stem cells culture are also available nowadays, which gives a very good result in treatment of male pattern baldness. Specifically up to some stage it's very effective.